Good afternoon, and today I have a pleasure of interviewing Dr. Suzanne Thai, my colleague from Texas. Good afternoon, Susan.
Hi, hello, Dr. Sokolina. How are you?
So, in this interview, we're going to discuss sleep disorder briefing.
Love it.
Susan Thai is a founder of DFW Sleep Solutions, author of the book Snoring, The Clue What Can Save Your Life, TEDx speaker, and internationally recognized uh, specialist on sleep disorder briefing. And we're going to talk about sleep apnea awareness, science, what not so much recognized by the medicine, by recognized by dental sleep medicine, public education, oral appliance therapy, and other solutions. But CPAP is not the only one, and how snoring affects women and why so many women not diagnosed, and how healthcare professionals can better communicate about the importance of sleep. So my first question to you, I'm so proud of your TEDx talk. So
Oh,
I
thank you.
want to ask you your practical advice. I also think about, I think that's the best way of educating the public. How you distill your message into one talk, and how that fact, what you had at TEDx talk, affect your mission.
Wonderful. So I've always, for as long as I can remember, as a young child, I love to help. I love to help in a lot of ways. And the best way I can help is through teaching, education, awareness, bringing awareness and information to people, my friends, my family, the public. And so forever, I always had a dream of doing a TEDx talk because I used to watch it all the time. I thought, oh, this is so good. Their message is so good. And so I decided to apply. I didn't think I was going to get it. Honestly, first try, I did not think. I went through the whole process. There was a process. It's you go through applications, you go through interviews, you go through second interview, you send video applications. And in the end, I kept thinking, all right, what do I want? The application process that was open, they said they wanted something where it was written together. The topic was written together. What's something written together? And I thought, what could I do? And there's a lot of things that happen in my life, as everyone's life. They have stories. And I thought, you know what? I'm going to talk about my transformation from being a dentist, a traditional general dentist, and transforming to being a sleep airway dentist because it was written together, meaning I did not do this on my own. I had my colleagues, my mentors, my family, my friends who made that happen. In the end, the idea was I wanted something broad enough to affect many, many people. And I thought, why don't I do something that I think is so people don't talk about it. Meaning, I had my life as a general dentist and I was happy in the beginning. And then later I found out I had no more joy in it. It did not make me happy. It stressed me out. If you watch my TEDx talk, there's a lot of issues that occurred due to stress. And I found my joy again. And that was in dental sleep medicine. And it was that transformation. So ultimately, my whole goal was not necessarily just to talk about dental sleep medicine or sleep apnea. It was to talk about how can someone change their life from being stuck in a situation or in a position that they thought they were supposed to be in and change it to something that they find joy and live life again. And I just go through those steps on what I did to make that happen. But in the meantime, when that was happening, I created the story of my life and the struggles and how I overcame it. But then sleep apnea came into play. So of course I discussed sleep apnea because I wanted to bring that to the public. And when I did, what changed was amazing because when I was in there speaking, there were actually a lot of physicians in the audience and I had no idea. Afterwards, they came up to me. They said, oh my gosh, I did not know oral appliance therapy could help sleep apnea. I didn't know, that people that had sleep apnea could be thin and small and you would never guess that. So I I had patients come in. I mean, not patients, but the doctors come stop me after the talk. They said, I want to refer my patients to you because they have so many patients who are not CPAP. They're CPAP intolerant. I had patients or people in the audience members come up and say, oh my gosh, I share your same story. I had this many miscarriages and I didn't know how to live life again. And so the connection that happened afterwards made this TED Talk everything I could possibly imagine, everything I could hope for, bringing awareness, helping people see that there's a way out of feeling sad, depressed. You don't have to be stuck in the same job or same relationship or same anything if you're not feeling good and happy. So that's what it was all about. And I'm so happy I did. I can't wait to hopefully do it again one day.
This is so beautiful because your talk was about reinvention, and I think it's so powerful. I actually like your story. Our career, very similar, like we discussed earlier.
Yes.
Dr. Suzanne Thai is also a diplomat of American Academy of Dental Sleep Medicine, just like, we did it in an approximately similar time. We serve on the board of this organization. But, this, your own reinvention and how you help to reinvent other people's life, I think it's a lot of respect. And I know we have medical professional in the audience. And if you listening to, very sincere presentation of Dr. Suzanne Thai about TEDx talk, that's the way to bring your message out. Through your story, through the difference you're making in the other people's life. I think it's a great vehicle, great way. So now I want to go back to our professional career to actually the question what a lot of patients ask me. Yesterday I had this, consultation. The question is the following: can someone thin, not overweight,
yes,
and not snoring, still have a sleep apnea? What's your view? How you respond to that question when you get it on a consultation? How come? Maybe that's a mistake. I'm so thin.
Absolutely. And for me, when patients come in for consultation, just like you, they come in for a reason. They don't just come in because, oh, I want to see Dr. Thai and Dr. Sokolina just because. They come in usually due to symptoms. And majority of my patients come in from a sleep physician or another doctor, and they're saying, we've done everything. We've tried hormone therapy, we've done all these things, but something is going on with my patient, and I don't know what it is. So many, and I know you treat the same. There's so many people who come in and they're completely thin or they're fit. It could be male, female, whatever that is. And they think, well, I'm not an overweight, middle-aged man, which is what many doctors used to think you had to be to have sleep apnea. So when you came through the doctor's office, then they might have high blood pressure. They might be a risk for, AFib. They have all these different things, and the doctors concentrating on that. Understood, because in the medical field they don't have the most time, and so they're there to answer the patient's questions. But when they don't necessarily think about sleep apnea, because they're like, well, let's take care of the blood pressure, let's take care of the AFib, let's take care of acid reflux, whatever that may be. But the patient may look thin, but if they are maybe overweight and middle-aged male, then they'll think, you know what, let's go ahead and get a sleep study. So they're kind of they get passed on, not because they want to, just because the knowledge is that that's what sleep apnea looks like. But the thin patients, they could have a very tiny airway and no one would know it, right? And so what sleep apnea is, when the tissues, especially obstructive sleep apnea, when the tissues relax and block the airway, blocking it partially is snoring, blocking it fully is apnea. Well, what if the patient is thin and they have a tiny airway and their tissues start to relax in obstructive sleep apnea, but it doesn't even get to the snoring part because the airway is so tiny, it goes straight to apnea? Well, then maybe, they don't snore. And maybe they're going straight to apnea, they're not breathing, but their bed partner, their spouse is not staring at them all night to know this. But the symptoms tell you. So if they say, you know what, I feel tired, I'm exhausted, I don't feel like myself, then you want to look further. If their medical history shows, I have high blood pressure, I have ADHD, I have depression, anxiety, look at the symptoms. If you see that, definitely get a sleep study. But even so, you might get a sleep study that comes back and it says negative. It might say you have zero apnea, oxygenation is okay, and the sleep physician or the doctor, they'll say, yep, you're good. You don't have sleep apnea. Let's move on. But again, look at the symptoms. That's what I do. So even if they don't show sleep apnea on the sleep study, I will still treat the symptoms. And example, myself. I never snored before. And as I aged, my husband said, honey, you're snoring. And I said, I am not snoring. We've been married 23 years, never snored, but I'm getting very close to menopause. I'm almost there. And so then when we get into menopause, we know we're close. We start to lose collagen, right? We lose collagen in our face. We lose collagen in the tissues in the back of our throat. Things start to get more relaxed. And so I used a snore app to just check because I did not believe him. And sure enough, I'm snoring. But what I noticed, because this is the thing, Dr. Sokolina, my energy, I only drink water. I drink nothing except for water. Everybody knows I don't drink alcohol, I don't drink caffeine, nothing. But when I wake up in the morning, when I get the appropriate quantity of sleep too, 7 to 8 hours, right? I wake up and I feel like my energy is 9, 10. Truly, that's me. I don't snooze, all the things. But as I started aging, I started feeling more tired. I noticed when I was driving home, I was like, why am I so tired? I don't have the same energy. So now I wear an appliance and literally no more snoring. My energy is great again. And see, I would have been dismissed so many times. I'm not saying that I'm skinny, but I'm not overweight, right?
You are skinny. You in great shape. I saw you in person.
You do. But that's what I'm saying. I would have been dismissed over and over and over again. And if it wasn't, I did a sleep study because all the sleep apnea companies could be, just like you. When we're in this field, then the sleep apnea companies will say, "Oh, try my sleep study." I tried so many, Dr. Sokolina, and I have no apnea. But I snore and I'm tired and I have upper airway resistance syndrome. That's what I believe I have. So I made myself an appliance, feeling great, feeling wonderful.
It's a wonderful example for a lot of women because I love how you mentioned what it's true when we get the medical knowledge about sleep apnea. It's a middle-aged, overweight male because the research 30 years ago was done on the veterans who are actually middle-aged, overweight males. And that's why they use this population for research, and that's how everybody imagined the disease. But
That's
just
right.
like you, I have a lot of women in my practice with the same symptoms, with the snoring, breathing. And I also love how you explain what some people might not snore. They might
Yeah.
not even snore and have a collapsed airway and sleep interruption like that. So that was a great explanation. It's like light a bulb in my head personally, and I'm gonna take it and use it now. So my
Yes.
question to you, you talk, I love your Instagram account and I watch those reels and they're very, artistic, and I highly recommend my audience to follow you to learn from two sides. As a patient, to learn, practical application, but as a medical practitioner, to learn how to present your field in a very sincere way. So we're gonna put all your links underneath this interview and your book and your TED talk. This way, people can know you better. Let's put it.
Oh, thank you
But
so much.
one more topic, what I reflect in my book Breathless, but not many people think about that, about acid reflux.
Yes.
How acid reflux, is it a symptom of sleep apnea? Or I want to know your view, not as a physician, but
Sure.
as a dentist, because
Yes.
we do see this disease in the mouth and other professionals. Very rare.
That's right. So a lot of times as dentists, we do see it in the mouth. And I love that. I feel, I wish more dentists. Yeah, I feel strong. I feel so lucky to be in the dental profession that we are because there are signs and symptoms that we see that maybe the doctor doesn't see, and that's okay. The physicians have their own signs and symptoms they look for, but as a dentist, you can truly tell if someone is at risk, right? You really can. And how? One of them is we look at acid reflux. Look at the teeth. The teeth look very warm. They have these wear facets or potholing look on the teeth. And they're wondering, well, I'm such a grinder. Are you a true grinder? Or is it because you have so much acid coming up that's eating away the enamel, making the enamel thin, you're cracking, breaking teeth, and it looks so warm? And so when, as a dentist, if you look and you see that, I wouldn't just jump straight to grinding. However, grinding is also considered an arousal for sleep apnea. But I would look, does this patient have sleep apnea? Because why? You have these patients when they fall asleep. And when they fall asleep, you start to see them do this. It's embarrassing, but I'm going to show you. But they'll snore. Keep snoring. And then they stop breathing. And they're quiet. And their spouse is staring at them. And then all of a sudden you see them do this. And they're gasping and choking. And that pressure, you're pushing the contents and acid from the stomach up, and it gets all over the teeth. Their throat is inflamed. So many times when I treat, many times when I treat patients with sleep apnea, they tell me, I am not having to be on that acid reflux medication. I don't need to do that anymore. I've lowered my pills. They're feeling better. So yes, it's very much connected. But as dentists, look out for that. Look to see the teeth. See if that could possibly be a sleep apnea issue or, any acid, soda, things like that. But definitely it could be related.
Number one, I have to take couple artistic performance lessons from you to show patients how to do that. I really love it. But number two, what I notice, a lot of people who had acid reflux before, now they say we don't have it, they have a stuffy nose. Because sometimes acid goes to the wrong tube.
Yes.
Also, yes, and they have inflammation. And I put it in my book, Breathless, but also, for our colleagues or even for patients who are wondering how come the nose is stuffed, might be allergy true, might be acid reflux as well. So we call it silent LPR, laryngeal pharyngeal reflux. It's not a bad idea to check with your gastroenterologist on that, secret sign. So I want to ask you that you're also big in your reels on REM.
On REM.
REM is so important. And what I noticed, I'm going to give you my own revelation about REM. It's true, REM changes with the time. I don't know, some people, when we did preparation for our exam, we learned what percentage of REM, what percentage of deep sleep approximately patients should have. I have to say, I see totally different numbers on the sleep study.
Mm-hmm.
I want to know your view on that. And I think maybe it's a very individual, property. Maybe there are not such a standardized knowledge we have about that sleep architecture side. I don't know. I want to see your practical view on that. But also for people who are wondering why they have a brain fog, I want your opinion why REM sleep is so important.
Yes, I mean, that's what we all talk about, right? We say to feel rested, we want quality and quantity of sleep. So quantity is 7 to 8 hours, right? 7 to 8. Quality is getting too deep in REM sleep. And the thing is, a lot of patients, when they have sleep apnea, they cannot get into deep in REM sleep. Why? Because every time they stop breathing, the body's really smart. It'll do everything it can to wake them up. It'll create those arousals. And the arousals, what we discussed, grinding and clenching, tossing and turning, kicking, gasping, choking, all those are considered arousals. So I tell patients, if you have any of those things, it doesn't have to be all of them, any of those things, and a lot of them have tossing and turning. It could be your body just trying to wake you up to breathe, right? So you're not getting into quality sleep. They say this over and over again. They sleep 7, 8 hours, 9, but they feel like they woke up and a truck ran over them. They feel so tired, right? But when you get to deep and REM sleep, that is where the quality comes in. And REM represents rapid eye movement, right? And so in REM, for patients to understand, we always ask, well, are you dreaming? When you're in REM, that's when you can dream. But it's also when you have what they call muscle atonia, which is like muscle paralysis. So they have muscle paralysis during REM because they don't want you to act out in your dreams and hurt yourself. But with REM, what's great about REM, during REM, you have emotional regulation. And I love that because you ever hear people say, time heals all wounds, right? Time heals all wounds. And it's true if you don't have sleep apnea, because if you don't get into REM, your emotional regulation is not there. My VA, I have a lot of veterans as patients, and they'll say, well, oh my gosh, why? My PTSD is so bad. I have to say, if you don't get into REM, your PTSD will continue to be bad. It's not going to get better because you don't have that emotional regulation that happens when you get into REM sleep. The other thing is, the memories can happen. And if you don't, patients say they have brain fog, you're going to have brain fog if you don't get into REM sleep. So learning, memory, emotional regulation, even like learning meaning skills. So a lot of athletes want to get into REM because they get better skills function, their skill acquisition that can happen during REM. And so I can't stress enough how important REM is, because when you get into REM sleep, then you can get less brain fog, better memory, less traumatic experiences that keep lasting your brain over and over again. And it truly helps your body and your brain when you get into REM.
I'm going to ask you last very embarrassing question. Tell me,
yes.
Can people gain weight here?
Absolutely.
And how that affects sleep apnea?
Yes, because we know when you have obstructive sleep apnea, what drops back? Your tongue drops back, tissues in the back of your throat drop back, right? But the heavier your tongue is, the more it drops back, correct? And so, especially in women too, like when we get into closer to menopause and as we age, we start to lose progesterone, estrogen, the fat distributes differently. A lot of times we get fats in our hips and our thighs, but once you start to get towards menopause and you lose that progesterone, estrogen, then the fat distributes differently. It will start to come towards the upper airway, towards the abdomen, towards the tongue. And so when you have that tongue that has more fat deposits, it becomes heavier. So of course, when it becomes heavier, it starts to drop back, it starts to block that airway. We get more apneas. This is why a lot of patients or women that go through menopause, they're getting more sleep fragmentation because they're getting more apnea. So the body's trying to wake them up to breathe again, over and over and over again. And also your muscles become more relaxed because when you have the estrogen progesterone, it tightens those muscles, it helps with muscle tone. But when you lose it, which happens or decreases significantly when you have menopause, then you get more tissues that are more relaxed and you get more airway issues that way.
Thank you very much. It was such a great artistic interview. So I really enjoyed, and I hope for my audience, what they will follow and learn about sleep in a very entertaining way. Thank you very much, Susan.
You're so welcome. Thank you so much, Dr. Sokolina.